Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery. Is no pain, no gain true? Or does too much pain lead to less gain? Written by Deborah Barker, PTA. Read by Carl Mina. I have been in physical therapy all my life, and I have treated a lot of knee patients, particularly over the last few years. In the physical therapy world, it is not uncommon for the PT abbreviation, which is supposed to stand for physical therapy, to also be referred to as pain and torture. Unfortunately, this is a very common reference for those who have gone through a total knee replacement. But is the no pain, no gain approach really the best? I explore the possibility of no rehab pain, more gain in this article. There are a couple of important things to consider during this difficult recovery. While range of motion is the immediate focus, there are some barriers to achieving this goal. While there are several reasons that range of motion can be limited, I would like to discuss the variables that can be directly affected by your therapy sessions. The inflammation response and the muscle guarding response that our bodies possess can be influenced by the type of treatment interventions that you receive after surgery. So, let's review how our body responds to injury. Inflammation is an automatic immune response. The acute phase is commonly recognized by pain, swelling, heat, and redness, and the lesser-known symptom, loss of function. But what if we keep re-injuring the same area and remain in this acute phase, for instance, with repeated, forceful, painful stretches? How is this promoting healing? Most acute symptoms can be controlled through medications and modalities, but what about the function we want desperately to return to our knee? The other issue to consider is the muscle guarding response. This is an involuntary protective response to pain and injury. This is our brain's approach to protecting and preventing any further injury or pain to our body. Most people at some point in their lives will experience this phenomenon. Those who undergo a total knee replacement know this all too well. So, let's get back to our therapy session and how this relates. I can't think of a reason not to muscle guard at this point. Your therapist might be a complete stranger who is now going to bend your knee as far as it will go or push down on your knee until straight. Some will push until you beg for mercy, whichever happens first. Does this sound familiar to anyone? As a PTA, I know we all have the patient's best interests at heart, but an aggressive approach can easily have negative consequences. Lewis's story. After ACL repair, the biggest obstacle to recovery is a seemingly endless cycle of rehab, pain, swelling, and then more PT. Lewis avoided rehab pain and got better after an ACL tear in a soccer game. Let's hear Lewis describe his story now.
Hi, my name is Luis. I live in Hackensack, New Jersey. I had an accident where I broke my ligament and I have two other ligaments tear. So I went to Dr. Patel in Teaneck. So I had surgery May 29 at Holy Name Hospital. After the surgery, I came home and I stayed on bed for 2 weeks. I started therapy in IV, physical therapy. We tried for some weeks to improve, but we hit a wall, and for some reason it was at one point very painful, and we were stuck in a point that we couldn't go further. That's when I got desperate. I saw people giving good comments about a machine called X10. I try to use the machine as much as possible. The machine is my new friend. I have the machine in front of the TV, so I just turn the TV on, watch a movie, watch music videos, because every time I use it, I see a little bit of improvement every time. My friends in the physical therapy office, they have me there and they have the opportunity to check me every time and see how real the machine is working, and they see the improvement. So they're very surprised Today I have an appointment with my doctor, and I know that he will be surprised of the improvement that I have right now, because last time he saw me a month ago, I was very frustrated. I was like at 75 degrees in range of motion, and I couldn't do a lot of things. And today I feel more confident that I will reach my target of 130 very soon. And I'm very happy because with the machine I'm seeing a lot of improvement and results in a very short period of time.
Could it be that we get more gain without pain? Maybe aggressive PT may not be the most conducive to healing or achieving maximal results. This does not mean that therapy should be avoided in any way, but perhaps a discussion about the techniques and open communication between you and your therapist should be established and maintained. Know that knee replacement recovery is not going to be pain-free, but excruciating pain should not be commonplace either. I believe no rehab pain, more gain approach can deliver better results and shorten the acute phase of recovery. At the end of the day, perhaps we should give PT another acronym, such as persistent but tolerable. To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.